Hi, welcome to Medical Monks, where your care is our highest calling. Today we're going to be taking a look at a product from our friends at Molnlycke called Hibiclens. And as you can see, it comes in a variety of different applications and sizes, and we're going to get into it. It's an antimicrobial, antiseptic skin cleanser. It's a workhorse of a product that's been around for 40 years, and you can't actually really afford to be without in a clinical setting and at home. But before we get to that, I want to talk to you about some of the nasty stuff, the stuff that we happen to share life on this planet with. MRSA. Don't Google that on an empty stomach. E-Coli, Salmonella, C. diff, Staph, Strep, all kinds of really nasty things. This stuff lives on our skin. It's on our skin already. It's fine so long as it doesn't actually get into our bodies, and how that happens is through abrasions and cuts. And then it can wreak havoc on our system and is really, really hard to get rid of. So how will Hibiclens help? Well, the really neat thing about this product is that it contains something called chlorhexidine gluconate. We're just going to call that CHG for the rest of this because it's a mouthful. It's the #1 pharmacist recommended product for washing and bathing for pre-op and post-op. CHG adheres to your skin. It actually forms a layer of protection that keeps acting for 24 hours. So it starts clinging to your skin and killing all of these microbes that live on it already. And then when you rinse it off, it's still working. There's still an actual barrier that is chemically bonded to your skin that is still giving you that protection long after you've rinsed it off. The really neat thing is if you do that 3 times, you will actually rid yourself 20-fold of the flora that live on your body. Couple of scenarios. Who and why? Why would you need this product? I did a little research and I was surprised to find the average person in the United States will actually undergo 9 invasive procedures. Now, in fairness, this could be, getting your wisdom teeth out, but 9 is a lot before you're going to have a procedure. Your doctor's going to recommend that you're going to wash with something before that surgery. So we're going to try and eradicate what's on the skin. So when we make those cuts and incisions, we're not introducing bacteria to the body, which is why we have this size. This is probably more for your clinical setting. We also have the 8-ounce and the 16-ounce, which is something you would want to keep in your home in this particular scenario. And then again, bathing after your procedure. At some point, all of us, or most of us, are probably going to have a loved one in a long-term care facility who may or may not be able to get out of bed and be immobile. And for that particular scenario, this is a really cool product. This is the Hibi Hubs. It's the Hibiclens Universal Bathing System. So what this is a packet that contains 10 cloths, and I pulled one out we're going to take a look at. These are substantial. These are not just wipes. These are pretty heavy duty. I started pulling at it, and it's pretty thick. There's 5 in there, and the recommendation is that you can use 1 for bathing and then 1 for rinsing. And that's great because in a setting, especially for, in a home healthcare setting or in a long-term care facility, you know exactly who this belongs to. It's clean and it's already sterile. And of course, we're going to recommend you're going to use this on your cloth. So you can actually open this. The recommendation is to put some water in there and then kind of smoosh it around and have them wet, and then they're ready to go. Seal it back up. Some of the other scenarios are a little bit more closer to home and scary, but athletes, if you've got kids who play sports, especially contact sports, they've got that stuff on their bodies already. And if they're sharing equipment, if they are sharing towels, MRSA is actually really common. It's scary. I didn't know that. As a mom, that's pretty common. And for those scenarios, there's a really cool packet. These guys you can toss in a gym bag. I had a cousin who actually caught MRSA from a gym. You can toss it into your purse. Take it with you if you're going to be visiting a loved one who's in a care facility or a hospital setting, and you just want the extra protection. I also saw patients online who said they'd like to take it hiking and hunting. Salmonella is on animals, so that's a really interesting application. Thank you for joining us. Be sure to hit the like and subscribe button at the bottom, and we'll see you next time.